Did you know that a pill you trust for pain, sinus pressure, mood, or menopause can also strain your heart or starve your brain of blood? I'm Dr. Alina Saracia, and I want to speak directly to every viewer over 60 and to every adult caring for an aging parent. Research shows heart disease remains the leading cause of death in older adults, and stroke risk rises with age. Today, I will walk you through 5 pill types that deserve extra caution, the warning signs most seniors miss, and the safer steps you can take with your doctor. Stay with me because one of these is sitting in many medicine cabinets right now. Comment below with the number of prescription or over-the-counter pills you take each day. Many seniors assume a familiar pill is a safe pill. That feels logical. If it is sold everywhere, or if a doctor prescribed it years ago, it must be fine. But aging changes the body. The kidneys filter more slowly. The liver clears drugs more slowly. Arteries grow stiffer. Blood pressure swings more easily. A dose that felt harmless at 50 can hit very differently at 70. Here's what happens when an older body handles medicine less efficiently. Drug levels can stay higher for longer. Blood vessels can tighten. Salt and water can build up. Clotting can shift. Heart rhythm can change. When that happens, a pill meant to relieve one problem can quietly add pressure to the heart, raise stroke risk, or reduce the safety margin your body once had. But here's the shocking part: most people don't know. Trouble can start before any dramatic symptom appears. Research shows the Centers for Disease Control and Prevention describes stroke as a brain attack, and brain cells start dying within minutes when blood flow stops. Research shows more than a third of people who have a transient ischemic attack, often called a mini stroke, and get no treatment will have a major stroke within 1 year. That is why hidden medication risk matters so much after 60. It is not just about side effects. It is about independence, speech, memory, walking, and survival. Comment stroke warning if you have ever had sudden numbness, slurred speech, or facial droop. Let me tell you about Margaret. She is 74, active, proud, and determined never to complain about pain. Her knees ache from years of standing at work, so she starts taking ibuprofen most mornings and again before bed. At first, it helps enough that she can shop, garden, and climb stairs. Then, the pattern changes. Her ankles start swelling. Her blood pressure, once controlled, begins creeping upward. She feels short of breath when she carries groceries. She assumes it is age. She tries to push through. Her daughter notices Margaret looks puffy and tired, but Margaret says she only takes a common pain pill. Emotionally, she feels trapped because the pill seems to help her knees while slowly hurting the rest of her. During a routine visit, her clinician reviews every bottle in her kitchen, not just her prescriptions. That review changes everything. Margaret learns that non-steroidal anti-inflammatory drugs, called NSAIDs, can raise blood pressure, increase fluid retention, and raise heart attack and stroke risk. She is skeptical because the drug is so familiar. Still, she agrees to a safer pain plan. Within 3 weeks, her swelling eases. Within 2 months, she needs fewer breaks when walking. She switches to topical pain relief, physical therapy exercises, and limited rescue use only when approved. She tells me the biggest change is not just less pain. It is feeling safe in her own body again. Comment knee pain if you have lived this story. And tell me your age as well. Now, this is important. I am not telling you to stop any prescribed medicine on your own. Some of these drugs help specific people when used carefully. I am telling you to stop assuming every common pill is harmless after 60. Studies found risk depends on your age, dose, medical history, kidney function, and what else you take. The first pill type that deserves caution is the NSAID family. That includes ibuprofen, naproxen, and diclofenac. Here's what happens when these pills block pain chemicals throughout the body. They can also reduce kidney blood flow, cause the body to hold sodium and water, and raise blood pressure. Research shows Mayo Clinic warns that NSAIDs can increase heart attack and stroke risk. with serious side effects appearing within the first weeks of daily use, and the risk rising with longer use. But here's the shocking part. Many people do not take these pills alone. They take them inside cold medicines, arthritis combinations, or after surgery, while also taking blood pressure drugs and aspirin. Research shows a USC study of 3,669 adults, ages 61 to 86, found that older adults using multiple medications with cardiovascular side effects had double or even triple the risk of heart attack, stroke, or death. And risk climbed with each additional drug. That is the domino effect seniors rarely see coming. The second pill type is the decongestant group, especially pills with pseudoephedrine or phenylephrine. Here's what happens when these drugs open a stuffy nose. They squeeze blood vessels. That can reduce swelling in the sinuses, but it can also raise blood pressure and make the heart work harder. Research shows the American Heart Association warns that people with uncontrolled high blood pressure, heart disease, prior stroke, or heart failure should avoid oral decongestants unless a clinician says otherwise. Let me tell you about Robert. He is 68 and still drives his grandkids to school. One winter, he catches a bad cold and buys a strong sinus medicine. He does not think to read the fine print because it is over the counter. After 2 days, his heart pounds, his pressure jumps, and he feels a tight headache behind his eyes. He tries coffee to shake off the fatigue, which only pushes things further. He feels shaky and irritable. His wife notices he is more flushed than usual. Robert tells himself it is only congestion, but what scares him most is how fast normal turns strange. He later learns the cold pill and his already high blood pressure were a dangerous mix. After that episode, Robert switches to saline spray, rest, fluids, and label checking before he buys anything. He also starts monitoring his pressure at home when he takes a new drug. Within days, the pounding feeling disappears. Within weeks, he feels more confident handling minor illness without gambling with his heart. Comment sinus pills if you have ever taken one without checking the ingredient label. The third pill type is prescription stimulants, such as amphetamine products or methylphenidate. These medicines have valid uses, but age changes the risk equation. Here's what happens when a stimulant revs the nervous system. Heart rate can rise, blood pressure can rise. Extra strain can hit a heart that already has stiff arteries or hidden disease. Research shows a JAMA Network Open study of older adults ages 66 and older compared 6,457 new stimulant users with 24,153 matched non-users and found a 40% increase in cardiovascular events within 30 days of starting treatment. Let me tell you about Linda. She is 67, recently widowed, and struggling with exhaustion and low focus. A new stimulant seems to sharpen her thinking, so she feels hopeful for the first time in months. Then she notices a fluttering heartbeat when she climbs stairs, and she starts waking at night with a pounding chest. Because the medicine improves her energy, she almost ignores the warning. Her daughter finally urges her to check in. Her clinician lowers the risk by reviewing her heart history, her blood pressure log, and every other drug on her list. Within 10 days of changing the plan, the palpitations settle. Linda tells me the lesson was simple. Feeling more alert does not always mean the medicine is safe for your cardiovascular system. Comment palpitations if a new medicine has ever made your heart race. Stay with me because the next pill type surprises many women who thought it only affected symptoms, not stroke risk. The fourth pill type is oral hormone therapy, especially estrogen plus progestin in older women. Hormones are powerful messengers. They act throughout the body, including blood vessels and clotting pathways. Research shows the Women's Health Initiative involved 27,341 postmenopausal women and found about a 50% excess risk of ischemic stroke with estrogen alone or with progestin. Other reports from that program found combination therapy raised ischemic stroke risk by 44% and estrogen alone by 39%. That does not mean every woman should fear hormones. It means the decision must be individualized. Let me tell you about Elaine. She is 72 and exhausted by returning hot flashes and poor sleep. A friend tells her hormone pills gave her life back, so Elaine asks to restart an old prescription. At first, she loves the better sleep. Then she starts ignoring calf tightness and brief spells of dizziness because she is so relieved to feel rested. Her clinician catches the bigger picture during follow-up. Elaine has high blood pressure, a family history of stroke, and long hours of sitting while caring for her husband. Together, they discuss non-hormonal options and risk factors she had brushed aside. Within a month of changing course, her dizziness stops. More important, she says the fear lifts once she understands why a pill can feel helpful and risky at the same time. The fifth pill type is antipsychotic medicine used in older adults with dementia-related behaviors. Sometimes these drugs are used during severe distress or dangerous agitation, but they carry major warnings. Here's what happens when a frail, older brain and body meet a sedating drug that can affect circulation, movement, alertness, and clotting risk. Falls rise, immobility rises. Cardiovascular complications can rise too. Research shows a BMJ study found that, compared with non-use in adults with dementia, current antipsychotic use was linked with higher risks of stroke, venous blood clots, heart attack, heart failure, pneumonia, fracture, and kidney injury. Studies found the stroke hazard ratio was 1.61, and the heart attack hazard ratio was 1.28. But here's the shocking part: most families never hear clearly. The danger is not always one pill. It is the pileup. A sleep pill, a pain pill, a cold pill, and a behavior medicine can all pull in the wrong direction together. Research shows half of participants in the USC analysis were taking at least one medication with cardiovascular adverse effects. 12% were taking 2, and 6% were taking 3. Stay with me because the next part is where we turn fear into a plan. One more hidden problem is silence. Many medication-related heart warnings do not start with crushing chest pain. They start with ankle swelling, new fatigue, sudden confusion, a pounding heartbeat, or pressure readings that drift higher each day. Studies found seniors often miss these changes because they seem ordinary. Comment warning signs if you have ever brushed off a symptom that later mattered more than you knew. Before I give you the safest moves, I want to show you what makes this problem worse. First, taking an oral pain pill every day without a medication review. Here's what happens when daily use becomes a habit. You stop noticing swelling, rising pressure, black stools, or breathlessness. The body adapts badly, while the person adapts mentally. Supporting story here is Margaret, who thought routine meant safety until routine became the warning. Second, taking multi-symptom cold pills without reading the active ingredients. Here's what happens when one capsule hides both a decongestant and an NSAID. Blood vessels tighten while blood pressure rises and fluid balance worsens. But here's the hidden disaster. Many seniors already take blood pressure pills, so they assume they are protected. They are not fully protected from a new drug that pushes the system the other way. Third, using several doctors and several pharmacies without one complete medication list. Here's what happens when no one sees the full picture. One clinician treats pain, another treats mood, another treats breathing. The patient sees separate problems, but the heart feels the combined load. Most seniors do not know that interaction risk often grows from ordinary medicines, not exotic ones. Comment, "I'm guilty," if you have been doing any of these. Do not worry, because you are about to learn how to fix it. Let me tell you about Harold. He is 79 and cares for his wife, who has memory loss. When her evening agitation worsens, he feels desperate for both of them to sleep. A new medicine calms the house. but it also leaves her slower, weaker, and less steady. Then one morning, she struggles to lift her right arm for a few minutes. Harold nearly dismisses it because the symptom fades. That short episode is a turning point. He calls for help and the family gets a full medication review instead of another quick patch. The care team adjusts the plan, reduces sedating medicines, improves lighting, adds routine, and treats triggers like pain and constipation. Over the next month, the home becomes calmer without relying on the highest risk approach first. Harold tells me he wishes someone had explained the trade-offs earlier. Now, this is important. Safer does not mean weaker. The best strategy is not panic. It is precision. Number 5 is a full medication review at least twice a year, and anytime a new pill is added. Do you know what happens when every prescription, vitamin, herb, and over-the-counter product sits on one list? Hidden duplicates appear. Dangerous combinations appear. Kidney dose problems appear. Research shows the USC study found risk rose sharply when older adults stacked 2 or more medications with cardiovascular side effects. Practical step: bring every bottle in a bag. Ask which ones raise blood pressure, clot risk, or fluid retention. And ask whether any dose still matches your age and kidney function. Expect clarity first, then fewer surprises later. Number 4 is switching from routine oral NSAIDs to safer pain strategies when possible. Here's what happens when pain control becomes more targeted. You can calm one painful joint without bathing the whole body in the same level of drug. Research shows American College of Rheumatology guidance has favored topical over oral NSAIDs for many older adults, especially age 75 and older with knee arthritis. Studies found a cardiovascular analysis reported topical NSAID users had a 36% lower risk of cardiovascular events than oral NSAID users. Practical step: ask whether a gel, patch, heat, physical therapy, strength work, acetaminophen, or a limited rescue plan fits you better. Early benefit may start in days, and long-term benefit is less pressure on the heart. Number 3 is choosing heart-safer cold relief. Here's what happens when you use saline spray, humidified air, honey if appropriate, fluids, and rest instead of automatically reaching for an oral decongestant. The nose may clear more gradually, but blood vessels do not get squeezed in the same way. Research shows the American Heart Association advises oral decongestants be used for the shortest time possible, and clinicians often recommend alternatives for people with high blood pressure or heart disease. Practical step: read the active ingredient panel. Avoid pseudoephedrine unless a clinician approves it, and check your pressure at home if you try any new cold medicine. Expect relief without the racing heart feeling that scares so many seniors. Number 2 is home blood pressure and symptom tracking whenever a medicine starts or changes. Here's what happens when you catch a rise early. You act before swelling, headache, chest discomfort, or breathlessness turn into an emergency. Research shows the American Heart Association advises people with elevated pressure to monitor at home, especially when taking medicines that may raise blood pressure. Practical step: check at the same time each day for a week after a new drug. Write down dizziness, palpitations, swelling, or sudden weakness, and call promptly if numbers climb or symptoms appear. Before I reveal the number 1 protection, which of these surprised you most? Comment below. Number 1 is using one pharmacy, one updated medication list, and one clear question at every visit. How does this new pill affect my heart and stroke risk at my age? Here's what happens when one team sees the whole board. They can spot duplicate pain pills, stimulant overlap, risky decongestants, and medicines that should be temporary but became permanent. Research shows older adults often carry several prescribers and several bottles, while the USC findings show additive cardiovascular risk with medication stacking. Practical step: keep a wallet list. Include doses. Include why you take each drug, and never assume over-the-counter means low risk. Expect fewer near misses, fewer rushed urgent visits, and more confidence. Here's what makes this powerful. These steps work together. A medication review finds the risk. A single pharmacy checks the mix. Home pressure readings catch early damage. Safer pain and cold choices reduce the trigger load. Breakfast can be oatmeal, berries, and water before morning pressure checks because fiber, hydration, and routine support steadier readings. Lunch can be soup with low-sodium broth, fruit, and a short walk because less salt and more movement help fluid balance. Dinner can be salmon, vegetables, and an evening bottle review because omega-3 rich foods, lower sodium, and awareness support the whole plan. Always be cautious if you have heart disease, prior stroke, kidney disease, uncontrolled blood pressure, atrial fibrillation, or if you care for someone with dementia. Ask your healthcare provider before using oral decongestants, daily NSAIDs, stimulants, or hormone pills, and never stop prescription antipsychotics suddenly without guidance. Watch for chest pain, sudden weakness, facial droop, severe shortness of breath, black stools, fainting, or a pressure surge. Research shows stroke damage can begin within minutes, so urgent symptoms always deserve emergency care. You now have the knowledge many seniors never receive until after a scare. The goal is not fear. The goal is wise review. The 5 pill groups I covered today are NSAIDs, oral decongestants, stimulants, hormone therapy, and antipsychotics in dementia care. The 5 protective steps are medication review, safer pain plans, heart, safer cold relief, home monitoring, and 1 coordinated pharmacy system. This is in your control more than you think. You do not have to accept medication confusion as a normal part of aging. Start with 1 step today. Put every bottle on the table. Ask 1 better question. Make 1 safer swap with your clinician. Comment 1 of 3 things: review, monitor, or ask. If you want more research-based guidance for adults over 60, subscribe now and turn on notifications because my next video covers the silent symptoms of heart failure that many adults over 60 mistake for normal aging. Comment medication check if you want me to make a follow-up video on the safest questions to ask at the pharmacy. If this video helped you, share it with someone who needs this information. You might save their life.